Taylor Siemens, and I am the clinical director here at Vitalyc. I'm so excited you joined us today. We are here with our Chief Medical Officer, Dr. Dimitri, at one of our amazing locations to chat all about facelifts and non-surgical facelifts, or what we call the liquid facelift. Could you tell us a little bit about yourself?
Yes, so I'm a double board certified facial plastic surgeon. As you mentioned, I'm the Chief Medical Officer here at Vitalyc. I have plastic surgery offices in Tampa, Florida and Beverly Hills, California. So I'm very excited to be here and sit down and chat with you.
We love when you come into town. You come in about once a quarter to see patients and to spend some time training our team. But what is it when we opened Vitalyc a few years ago that said, hey, I want to be a part of that?
I think it was the message from the leadership team about our commitment to excellence in aesthetics. So, we have a very devoted team all the way from the top down, and our eye for aesthetics I think is very important. So we really want our patients to walk out of here feeling better, more confident, more comfortable in themselves.
So you are a surgeon. We know you love your OR, your scalpels, incisions. Walk us through a little bit about what a facelift actually is.
Yeah, so a facelift is a surgical procedure. It's actually one of the most common procedures I perform, and it's really reserved for patients who have a tremendous amount of skin laxity, meaning there's a lot of looseness in their neck, skin, their jowls, and really we need to remove that and then tighten and lift the muscles underneath.
Compare that with someone doing a liquid facelift with the dermal fillers.
Yeah, so a liquid facelift is a great option, and it's really reserved more so for someone who doesn't have all that loose skin just yet. And perhaps they're starting to develop some jowls, some concavities along their jawline, and really we can perform hyaluronic acid-based injections to lift and restore some volume loss areas.
And how would someone know if they are a candidate for something like that?
Well, first off, I would encourage that person to come into the med spa so one of our experienced injectors can evaluate them. But really, again, it's the areas where they're starting to have some volume loss where we can perform the injections to lift and restore.
I love that you bring up consultations because that is something we get a lot. People spend a lot of time on the internet trying to decide what they can and can't get before they even come in. And so a question we get often from our patients in the chair is, if I get this filler procedure or treatment, is it going to prevent me from being able to get surgical treatments in the future? What are your thoughts on that?
That's a great question, and I'd say no. I mean, filler a lot of times can be done as something that's preventative, and it helps actually, again, we're restoring volume that we start to lose as we age. So we do see a wide variety of patients here in their 20s, 30s, all the way to 50s, 60s. And so it is important to have a thorough assessment and for us to really analyze their face and see where we can restore volume in certain areas.
And I love that. Our patient coming on next, she has been a patient here at Vitalyc. She's in her 30s, she just turned 30, and so she wasn't a candidate for a surgical procedure yet. And so I'm excited for her to come on so you can hear her story and why she chose Vitalyc for these treatments. Hey Alicia, thanks so much for joining us today. Hey, I'm so curious, could you just share a little bit about what made you say, hey, I think I might want to get fillers? What was going on with that?
Well, when I turned 30, I noticed a little sagging here, and I don't know if it's because I laugh a lot or smile way too much, but I wanted something a little bit more of a lift. I also have a hereditary no chin. I get that from my mom, so it's like chin, neck, and it looked like I had a double chin, but really all it was just skin. There was no weight that I needed to lose. So what I wanted was more definition, a more structured jawline, and something that looks more even from the side.
Yeah, great, I love that. Dimitri will kind of dive in on your results here in a minute, but I'm so curious, why Vitalyc? What attracted you to us?
I actually just moved to Dallas, and I had not new to the filler game. I got lip filler when I was 25 and just kind of continued the upkeep with that in Austin. And then when I moved to Dallas, I visited 3 med spas, and Vitalyc really stood out the most because it was the first time I felt very comfortable inside of a med spa, even more comfortable than the med spa that I was going to back home. I learned a lot more things about filler and the process and even dissolving and starting new than I ever have before. And like, it was so weird to me. I've been doing this for half a decade and I still learned more than at Vitalyc than I did anywhere else. So I felt like my face could be trusted in your hands. So I love Vitalyc and I won't go anywhere else.
You know, it's music to my ears as a clinical director because that's something we preach all the time to our clinicians is education, education, education. We should be equipping our patients with the information they need to choose their injectors and be a part of their treatment plan. So I'm so glad that you had that experience. But tell us a little bit about the actual treatment process. Was it painful? Did you struggle with it?
No, not at all. Actually, I have a high pain tolerance, but I will say, Kelly, the one who injected me, this is, again, something that I've never experienced before. She took the time to massage the numbing cream into my skin, and she said, well, your skin is porous. So just like you don't just throw lotion down and just walk out, you rub it in. Same thing with the numbing cream. It works better when you take the time to get it into your pores. And then she also used a little ice globe, which I've never had used on me before. And that helped with the numbing process even more. I didn't feel a thing.
I love that. Yeah. Great. Well, Dimitri, can you kind of walk us through just, a typical 30-year-old face and why maybe we would choose the liquid facelift over surgical option?
And I'm looking at her, and I'm looking at her profile view, and she has a beautiful jawline. So in this case, of course, surgery, should not come up. And she's a great candidate for non-surgical options, which is what we ended up doing. Now, she mentioned her chin. So of course, when you're looking at someone's profile view, you want to really assess things from top down, left, right, in the middle. And I think adding some filler into her chin really enhanced her profile view. It gave her a little bit more projection, which I think is a very nice touch. Also, when she was mentioning some volume loss in her cheeks, I mean, that does actually start in our late 20s, early 30s, where we start to see some volume loss. So I think a little hyaluronic acid-based filler in there, just a little bit goes a long way. We always want to stay natural. Patients walking out still looking like themselves, but just a little refreshed.
Yeah, I want to highlight that too. At Vitalyc, we love natural looking results. And so our whole goal is not to augment you into someone else, but just to highlight the best features that you already have. Like Alicia was saying, she just noticed hereditarily her chin was a little depressed. We weren't trying to make her into someone new. We're just highlighting and enhancing the things that are already there. So I think that's a great point. Yeah. So I'd love to compare and contrast someone like Alicia in her 30s, who's a great candidate for filler, into someone who is maybe in a different stage of life, who might be a better candidate for surgical results, or maybe even be able to buy them some time with dermal fillers. So let's hop in with our next patient. Kelly, thank you so much for joining us today. I know that you've had a couple of filler treatments and some other services with us at Vitalyc, but I'm curious, could you just share a little bit about yourself, maybe how old you are, and what signs you've seen of aging in your face the last few years?
Well, I'm 53, and I've definitely noticed my cheeks have gone down, my smiley was saggy, and I have, my double chin has been really coming in, and I have some wrinkles coming on my neck.
Well, I think that you are very representative of the average patient for us at Vitalyc. We have a lot of 50, 60-year-olds who are coming in and trying to decide, aging naturally with dermal fillers and services or jumping to surgical options. And so I'm curious from your perspective, Dr. Dimitri, in a consultation, what are some things that you would be chatting with her about?
So I think we would, chat about the areas that concern her, and I would like to go over the options of non-surgical versus surgery. So, she mentioned her neck and some of the gels. That's something that could perhaps be addressed with radiofrequency microneedling. That's a service we offer here at the Med Spa. It's done over 3 sessions. It's a non-invasive option with pretty much minimal downtime. And I think patients do see some nice tightening in the gels and the neck skin. The next thing would be perhaps some fillers, a little bit of Botox to soften wrinkles and lines throughout her glabellar area and her forehead. Then, if the patients are like, I just really want something that's going to last maybe 10, 15 years, at that point we would probably have more of a surgical discussion.
For someone who's considering surgery in maybe the next year or two, is it an issue for us to start on these non-surgical options? Should we hold off on those?
No, in fact, I think, considering a laser resurfacing treatment or even the radiofrequency microneedling, that enhances her skin, the texture, the tightness. So if anything, it'll actually improve the surgical results. So I don't think those are things that we have to hold off on. And it's nice too that they perhaps buy the patient a little time.
I think that's great. Well, hey, let's hop into a treatment room. I think it's a great thing whenever we can actually see Dr. Dimitri's hands on Kelly, hear some of her concerns, and actually see what he would do in a treatment here at Vitalyc. So let's step into the treatment room.
All right, welcome in. We're now in the treatment room, and we're really going to dive into things. I think one of the easiest ways to go about a formal assessment is really just going top down. That can help because then we won't really miss anything. So earlier she was mentioning some of the things that bothering her were her forehead wrinkles and her 11s right here. So go ahead and furrow for me. Good. You can see her 11s right here. So a little bit of Botox into this area here and here will help treat those lines right there. Now lift up your eyebrows for me, and then we can see the wrinkles that are forming across her face as well. So Botox injections, or a neuromodulator, they help relax the muscle. So you can see here I'm kind of drawing where I would usually do my injections to help soften these wrinkles. Now go ahead and smile for me. We're going to work downwards a little bit, and you can see these fine lines are forming right here. These are called her crow's feet. That's due to a muscle underneath the skin there around the eyes, and when that muscle contracts, we get these fine lines. So again, a quick, easy Botox injection can help soften these lines. Now we're going to talk, she mentioned the smile lines and her marionette lines. And these are starting to deepen as we age. And so one way to get an elevation here is perhaps doing some deep filler injections in this area along the bone here, and those can help elevate the smile line and the marionette line. Now moving down into her lip area, you can see she's got a thin upper lip, and it's a little bit dry. So one thing that would be really nice is a little bit of hyaluronic acid injections, a lip filler injection, just a little bit to help plump her lip. It helps actually moisturize the lip as well. We don't want to overdo it. We don't want to give her anything unnatural, any ducky lip appearance. So just doing a little bit, I think, will go a long way. Now finally, we were looking here at her neck, and she's got fine lines that are starting to form and some platysmal banding as well from the muscle underneath. So one option, one non-surgical option which we offer here in the med spa is something called radiofrequency microneedling. That's a session of 3 series of treatments, and where we're delivering energy underneath the skin. It's radiofrequency energy that promotes new collagen formation, which can help tighten the skin and actually get some nice elevation as well. So if you see, if we could get that for her, right in here, we're tightening, I think she would be really pleased with that, especially something that's non-surgical. So it looks like we've got a pretty thorough plan, top down. I think we're doing a very formal assessment, and we're gonna, listen to her, what she wants to achieve from a non-surgical perspective.
One of my favorite things about Vitalyc is how much we value training, and we spend a lot of time and resources on training our team. In fact, one of our goals for this year is that we have over 1,000 training hours for our clinical team, and we are on track to surpass that already just starting the year. And with that comes learning a lot of different techniques and ways to do these treatments. And one of the questions that we get from patients is, how do you know what filler I need? What type of techniques there are. The most important one is difference between cannula and needle. So could you address that for us?
It depends, of course, the area that we're injecting. The cannula is a soft, blunt tip needle that is inserted underneath the skin. Versus a needle injection, it just goes straight in. So it depends on the area. A lot of times if we're injecting the tear trough or the under eye area, it could be nice to use the cannula because it glides in smoothly underneath the skin surface, and you can deposit the filler slowly as you withdraw it. This is an area that perhaps is a little bit more prone to bruising, and so in those instances, you may want to consider the cannula. However, if we're talking about Botox injections to the forehead, that's of course done with a needle. Lip filler injections, more likely to be done with a needle as well.
Okay, great. And so say someone has come in, they've done their consultation, they're a great candidate for these non-surgical options. What can we expect as far as downtime, and how long these procedures will last, the result?
Downtime is relatively minimal, depending on the area that's injected. Of course, some bruising and swelling can develop, which is normal and expected with a needle being injected underneath the skin surface. But here we have a great protocol where we're applying ice right afterwards. We have arnica cream to help with bruising, swelling. And so right after your injection, you're really getting a VIP treatment to make sure you heal as quick as possible. Now, as far as the duration of the filler, that depends on the location and the choice of filler that is used. Some of these products can last 6 months, all the way up to 18 months, even 2 years. So it really just depends what our experienced injector decides to use and what area they're using it in.
All right, Alicia, so it's been about a month since you had your liquid facelift with us. Tell me a little bit about what you're enjoying most about your results.
I really loved the instant confidence it gave me. I mean, the results are instantaneous. I love that there was a lack of bruising. The healing process was quicker than I thought it would be. I was able to enjoy the best results in about a week, which was amazing. The way I look in photos give me more confidence. I can see my profile, I can see the definition in the mirror, in photos, whatever. I just love it. It's a great confidence boost.
Yeah, I love that. You know, we focus so much on the clinical outcomes with people all the time, and it's just refreshing to hear from a patient standpoint of, you know, she didn't mention how she's more defined or how many syringes we did, but just speaking to the confidence that it provided for you, and I think that's really amazing. You know, and something that our patients are afraid of pretty often is looking fake or unnatural. Has anyone noticed that you've had treatments done? What's kind of been the feedback?
Nope, no one has noticed. I'm the one who has to be like, hey, I got jaw filler. And they're like, wait, what? I'm like, yeah, and they're like, oh, I can see now. I can tell the difference. Anytime I ever get anything done, I want it to look natural. And like you said, I want it to enhance my natural features. I don't want to look any different. I just want to look like a better version of who I already am. So that's definitely what I feel like right now.
Yeah, something I've said for the last 8 years I've been doing this, and it's something many injectors say, but the best injectable is the least detectable. And we really believe that at Vitalyc, that we are wanting people to leave feeling more like themselves, an enhanced version of themselves, not like they had a bunch of volume pumped in their face. So I think that is fantastic. Dr. Dimitri, thank you so much for your time and giving us some insight on this today.
Yeah, it was great being here. I love serving as the Chief Medical Officer for Vitalyc. I'm here often providing treatments to patients as well, and I can't wait to see some of you in the building.
Thank you so much for watching this video today to learn all about surgical facelifts versus non-surgical options. We would love to see you here at Vitalyc and offer you a complimentary consultation to determine what options really are best for you. So if you'll visit us at vitalyc.com, we will see you soon.